Nurses are the heart of healthcare. They are the compassionate caregivers, the patient advocates, and the frontline heroes who work tirelessly to heal and comfort. Their dedication often comes at a cost, as they face a unique set of occupational hazards that can impact their physical, mental, and emotional well-being. These hazards are often invisible to the public eye, but are very real for those who experience them daily. This essay will shed light on the often invisible risks that nurses face every day. From the physical strain of lifting patients to the emotional toll of witnessing suffering, the challenges are multifaceted and demanding. We will explore the physical, mental, and emotional challenges that come with this noble profession. Understanding these hazards is not only crucial for nurses themselves, but also for healthcare institutions, policymakers, and the public at large. By raising awareness, we can work towards creating safer and healthier work environments for these essential healthcare professionals. From better ergonomic practices to mental health support, there are many ways to improve their working conditions. We will also look at the role of healthcare institutions and policymakers in ensuring the safety and well-being of nurses. Their support is crucial in implementing effective safety protocols and providing necessary resources. By understanding and addressing these risks, we can help nurses continue to provide the high level of care that patients depend on. Their well-being is essential for the overall health of our communities. Together, we can make a difference. By raising awareness and taking action, we can ensure that nurses have the support and resources they need to thrive in their vital roles. Nursing is physically demanding work, requiring both strength and endurance. Nurses are constantly on their feet, lifting and moving patients, and working in awkward positions. These tasks are not only physically taxing, but also require precision and care to ensure patient safety. These repetitive motions and heavy lifting tasks take a toll on their bodies, leading to a high rate of musculoskeletal disorders. The physical strain can accumulate over time, causing chronic issues. Back pain, neck pain, and joint injuries are common complaints among nurses. These ailments can significantly impact their ability to perform daily tasks, both at work and at home. Studies have shown that nurses have a higher incidence of these conditions compared to other professions. The demanding nature of their job puts them at a greater risk for developing long-term musculoskeletal issues. The constant strain on their backs from lifting and repositioning patients, combined with long hours of standing and walking, can lead to chronic pain and disability. This ongoing physical stress can also affect their mental well-being. While ergonomic equipment and training can help reduce the risk of injuries, it's crucial to acknowledge that the very nature of nursing involves physical demands that cannot be entirely eliminated. Proper techniques and tools are essential, but they are not a complete solution. Addressing these hazards requires a multi-pronged approach, including adequate staffing levels, assistive devices, and a culture that prioritizes nurse safety. Ensuring that nurses have the support they need is vital for their health and the quality of patient care. Beyond the physical demands, nurses face constant exposure to infectious diseases. Hospitals and clinics are breeding grounds for bacteria and viruses, making nurses particularly vulnerable to contracting and spreading illnesses. From the common cold to more serious threats like COVID-19, influenza, and hepatitis, nurses are on the front lines of exposure. They work in close proximity to patients, handling bodily fluids and contaminated equipment, which increases their risk of infection. While personal protective equipment, PPE, like masks, gloves, and gowns provide a barrier of protection, they are not foolproof. Proper training on the correct use and disposal of PPE is essential to minimize the risk of contamination. The healthcare environment exposes nurses to a range of chemical hazards. From disinfectants and cleaning agents to anesthetic gases and chemotherapy drugs, nurses handle potent substances that can have both immediate and long-term health effects. Prolonged exposure to disinfectants can irritate the skin and respiratory system, while some cleaning agents contain volatile organic compounds, VOCs, that can cause headaches, dizziness, and respiratory problems. Anesthetic gases, if not properly ventilated, can lead to neurological issues and other health concerns. Chemotherapy drugs, while life-saving for patients, pose significant risks to healthcare workers who handle them. These potent drugs can be absorbed through the skin or inhaled, leading to a range of side effects including hair loss, nausea, and an increased risk of certain cancers. Section 5. The weight of empathy. Psychosocial hazards in nursing. The emotional demands of nursing are often overlooked but are just as significant as the physical risks. Nurses are not only caregivers, but also emotional anchors for their patients. Nurses provide care to patients during some of the most vulnerable moments of their lives, witnessing suffering, grief, and death. They are there to offer comfort and support, often putting their own emotions aside. This constant exposure to trauma can take a toll on their mental and emotional well-being. The weight of these experiences can accumulate over time, leading to significant stress. Compassion fatigue, a state of emotional exhaustion and reduced empathy, is a common experience among nurses. It can make it difficult for them to continue providing the high level of care that is expected. The constant giving and caring for others can lead to feelings of burnout, depersonalization, and a decreased ability to feel compassion. This can affect their job performance and personal lives. In addition to compassion fatigue, nurses are also at risk of experiencing violence from patients or their families. This can create a hostile and unsafe work environment. The frustration, fear, and pain that patients and families experience can sometimes manifest as aggression towards healthcare workers. This adds another layer of stress and emotional burden on nurses, making their job even more challenging. Section 6. Shielding the protector's essential safety measures for nurses. Protecting the well-being of nurses requires a multifaceted approach, addressing both physical and psychosocial risks. Hospitals and healthcare facilities must prioritize safety measures to minimize occupational hazards and create a supportive work environment. Implementing ergonomic programs that focus on safe lifting techniques, providing assistive devices for patient handling, and ensuring adequate staffing levels to prevent overwork are crucial steps in reducing physical strain and injuries. To mitigate biological hazards, strict adherence to infection control protocols is paramount. Providing adequate PPE, ensuring its proper use and disposal, and promoting a culture of hand hygiene are essential measures to prevent the spread of infections. Section 7. The importance of self-care. Prioritizing nurse well-being. While institutional changes are crucial, nurses must also prioritize self-care to mitigate the impact of occupational hazards. Recognizing the signs of burnout, compassion fatigue, and physical strain is essential for early intervention. Engaging in regular physical activity, maintaining a healthy diet, and getting enough sleep are fundamental to physical and mental well-being. Taking breaks throughout the workday, even if for a few minutes, can help reduce stress and prevent exhaustion. Seeking support from colleagues, supervisors, or mental health professionals is crucial for processing emotional stress and developing coping mechanisms. Nurses should feel empowered to speak up about their needs and access resources that promote their well-being. Section 8. A call to action, advocating for safer healthcare environments. Creating a safer and healthier work environment for nurses requires a collective effort from healthcare institutions, policymakers, and the public. Hospitals and clinics must invest in safety equipment, provide adequate staffing, and foster a culture that prioritizes worker safety. Policymakers play a crucial role in enacting legislation that protects healthcare workers from violence and ensures safe working conditions. This includes supporting initiatives that address staffing shortages, promote workplace safety training, and hold healthcare facilities accountable for maintaining safe environments. The public can contribute by advocating for policies that support nurses, treating healthcare workers with respect, and recognizing the essential role they play in our society. Section 9. Conclusion. Honoring nurses' sacrifices, protecting their future. Nurses are the backbone of our healthcare system, providing compassionate care under demanding circumstances. Their dedication and sacrifices deserve our utmost respect and appreciation. However, their well-being is often overshadowed by the very nature of their work. By shining a light on the occupational hazards nurses face, we can begin to address these challenges and create a safer and healthier future for these essential healthcare providers. Investing in their well-being is not just a moral imperative, but a necessity for a robust and sustainable healthcare system.